Welcome to the Beauty Scientists with Dr. Kristy Hamilton and Dr. Roy Kim. Real beauty without the hype.
Hi, I'm Dr. Kristy Hamilton here with
Dr. Roy Kim.
And we are the Beauty Scientists. So welcome to our next episode. We are so excited to talk about international flavors of aesthetic plastic surgery. Today, Dr. Kim just came back from a conference and meeting in South Korea, which we all know has the highest concentration relative to the population of aesthetic plastic surgeons in the world. So beauty is big there. We already know so much about South Korean skincare regimens, and we got the 10-step, 12-step regimens with double cleanses from them. So South Korean beauty is definitely having a moment in Western markets too. And I just cannot wait to hear about what you learned about. So I wanted to start with the eyes. But maybe first off, your just initial impressions of the country and their view on beauty.
Yes, so just in case you didn't know, yes, I'm ethnically Korean, but I was born in the U.S., grew up in the U.S. I've never spent extensive time in Korea. So I went for a plastic surgery conference, APS, Aesthetic Plastic Surgery Conference, and I also was able to go a couple days early, so I went to a couple clinics. There's a sharp demarcation where everybody stays in their lane. Nurses don't do anything. I mean, they're there to assist. There are no nurse injectors at all. Dermatologists do all the injecting, all the non-invasive stuff or less invasive stuff, and they do not do surgery. The plastic surgeons really stick to surgery. They really don't want to do anything injectable. They'll use a laser in conjunction with surgery, but they don't do it if they can help it. And so that's just how it is in Korea. I think the other thing is that they think it's weird that in America we do more than a couple types of procedures or specialize in them. In Korea, if you're a dermatologist, you're going to stick to like a couple things. Like they actually have people who do mainly injectables, not much laser. They have people that do lasers and not much injectables. They have plastic surgeons that typically will only focus on 2 to 3 procedures. Some of them just do one type of procedure. And that's just how it's done. They feel that you have this hyper-specialize in some body part or some procedure to get good at it and to do business with it. They just don't like it if a plastic surgeon does 8 procedures or 8 different types of procedures.
I wonder too if that is a function of just how many plastic surgeons there are there relative to the population. You really have to make a name for yourself. So perhaps as we're training more plastic surgeons in the United States, we'll see a little bit more of that hyper-specialization as well.
I agree with you. I think part of it is not reality-based. Part of it is that they join typically a group and they just have to hyper-specialize in something.
Makes sense. So yeah. I'm sure you saw just some things that were just wildly different than our norm. What's the number one thing that stood out? Like, what was something that you're like, wow, I would never see this in the United States. Maybe it doesn't even seem like a good idea.
So, this is a controversial topic and you're going to love this. I went to a plastic surgery clinic that is called lifting or lifting. They actually spell it Liting, where they were kind enough to give us a tour and behind the scenes tour. So I rattle off the statistics: 9 floors, 33 operating rooms, 55 patient care coordinators, 15 plastic surgeons, 5 dermatologists all in one group. And the only thing they do is facelift, neck lift, facial rejuvenation. That's it.
Wow.
They won't really do your nose. They will refer that out. They'll do your eyes in a pinch, but they technically have almost no one that specializes in it. They don't do ears. They don't do anything else. They just focus on facelift, neck lift. And the most unusual thing to me is that they will do combination procedures with threads, filler, and HIFU, high intensity focused ultrasound, along with surgery. So I spoke to 2 of the plastic surgeons there, the main person and one of the residents. And yes, they'll bring you to the operating room as a plastic surgeon and a patient, and they will numb you up, they'll give you sedation, and they will do threads, non-fat filler. They may give you a HIFU treatment or they may recommend it later, and they will make sure it looks good. If it doesn't look good enough, if it doesn't lift enough, they will then make an incision and just do a limited to normal incision facelift. Now, in the US or the West, we think that threads obviously are like an office procedure. Nurses can do it, derms can do it, whatever. We don't do it in combination with surgery.
No, because our thought is if we want the longevity, we're going to go straight to the invasive procedure. And also probably, I think we want to prepare our patients to be recovering from a major operation, as opposed to like maybe you're just going to do a little bit of threads. And do you offer threads in your practice?
I do not, but after going to that practice, I may start doing it, because there is a market for less invasive or limited incision. I also think that in the West, in the US, we have some complications with threads because we're trying to do too much. We're trying to bunch up the skin, tighten the skin too much, tighten the mask too much. In Korea, they're doing like this full-blown facelift neck lifting on 30 and 40-year-olds.
And that is what I wanted to talk to you about, because you're the one that put that on my radar. You're like, it's very, very normal to be 30 years old, maybe younger even, and having the facial reshaping surgery. And I'm going to ask you about this, but this is what you told me. And I have had one patient who had surgery over there who was telling me about it too. So what she was saying is that you have to have the facelift after you shave down the jaw to get that more heart-shaped face. Otherwise, it's going to prematurely sag you. So they're kind of anticipating that and just doing full-blown facial reshaping, facial liposuction, and ultimately the facelift on people in their late 20s, early 30s. So did you see that? And what did you think?
Yes, I saw one case. And generically, in case the viewers don't know, you can, in terms of bone, reshape your face. So you do a zygomatic infracture, you shave like this way a portion of your mandible. East Asians, Koreans typically have a wider face, like a squarish shaped face or more prominent mandible, and they want it more round / V-shaped. So the way you do it with bone is like literally do craniofacial surgery, and then you can tighten the mass or underlying structure to get a more V shape as well. So what you said is true. If you're a little older and you're not that old, in other words, if you're a patient and you're not that old, but you decide to get this when you're 30, 35, 40, I could totally see why bone reshaping in and of itself would be insufficient, because you will have saggy skin here or early jowling. So they recommend, let's do the bone reshaping, the craniofacial surgery, and you're going to get a facelift at the same time. So that is a relatively common procedure. I mean, here in the US, we're not doing zygomatic infractures or like doing bony surgery to make your face thinner. I mean, buccal fat pad, neck liposuction is a little controversial, but we can reshape the mid and lower face using non-bone procedures. But to do bone procedures, I don't know how common that would be.
No, and then we're definitely not doing facelifts on top of them. So that's a totally novel expression. But the results they look spectacular. I'm sure it's a fairly involved recovery when you're making facial fractures. We all know what facial trauma looks like. So I'm sure there's a lot of hand-holding with the patients to get them there. But it's interesting what people will do. So I think when I see Asian patients with a square jaw, and may not be Asian, but it's definitely popular in my population, we're doing a lot of like masseter Botox, so kind of simpler things, less invasive things to slim the face. So that's definitely popular. But I'm not doing any bone shaving and facelifts. And to your point as well, it seems like it's a team approach. Like one surgeon will come in, do the bone shaving, like you were saying, even within the same surgery, and then someone else will come in and do the facelift or liposuction afterwards. Is that what you saw too? Like a whole team of doctors?
There is a team of doctors. There's a team approach. Most of the doctors will do the whole procedure themselves. But yeah, some clinics, they have the bone specialist and the soft tissue specialist, which sounds a bit much, but that's what they think is good. The other thing is they definitely take a more packaged deal. And I'm not talking just money. I'm talking about they will have pre-op counseling. They'll make sure your diet's good beforehand. They have a 23-hour stay location at a lot of clinics and small hospitals, so you stay there overnight. They have hyperbaric oxygen. They have various specialized facial things, which I'm not, to be honest, I don't think their facials really aid in healing, but it's just part of the package. They will give you diet, like food packets to take home because they think that certain types of food will reduce swelling, reduce bruising, and increase healing. It's a bit nuts to us, that much control and compliance, but that's what they believe. And that's what they do typically for these moderate to larger cases.
And I guess that gets you ultimate control over what's going on. And if it speeds the recovery, it sounds maybe it's worth it. Were any of those components, are you tempted to implement any of them? Were you inspired?
I am, because if you look at just different body parts, it will drive up the cost of care. But I do think that for patients, it's a more holistic overall, I have one doctor who's going to take care of everything approach. Like, for example, we always get asked about scars. Every plastic surgeon does. And I don't think we actually treat it seriously enough. So in Korea, they actually have, you're going to love this. We don't have this in the US. Anti-scar impregnated bandages. They're impregnated with silver, hydrocolloid, other things like that, which actually help reduce, we know help reduce scar tissue, but they're not available in the US at all. And so if we give our patients something where it says, look, your scar is going to heal up within 1 or 2 weeks. After that, you need to wear this special bandage. You need to wear it all the time. You need to have it look, cut a certain way. We're going to make certain that your scar is as beautiful as possible. There's a complimentary laser treatment after every facelift. Mm-hmm. So you're going to come in at least once and get laser for your scar. We will ensure that we will do anything and everything possible to give you the best long-lasting result. And I don't really perceive that if I do a facelift neck lift in the US or other surgeons do, that's included.
Mm-hmm. I include vascular, like V-beam laser treatments for my scars because I'm fortunate enough that I have it, and I have, my population varies wildly, but I have a lot of patients with more melanin in their skin, so I found that to be helpful. But that's something that definitely people are surprised by. But I think it helps so much, and you have this early window to really make a big difference in the scar, and by the time people realize it's not going too well, then you're often just back at square one talking about scar revisions with them. But I agree. I think Western plastic surgery, American plastic surgery is definitely a la carte.
Yes, yeah.
And it's if you want to do your tummy tuck and your liposuction, well, all of that's added on. But sometimes you look at patients and you just know you're not going to be happy with this unless you do at least some of the liposuction to really get that shape. It's not just about getting the flat tummy. So I like that concept of a more holistic approach and bundling in everything that patients need, so they don't get left needing something that they didn't plan for.
Yeah, I think some of it's money, and a lot of it's not about money, because some of these treatments are they really making much money if they send you home with food? I don't think they are, to be honest. They just think that it's that important that they want to take care of you as a human being. That's all.
And I think that's wonderful. And it's that way they can sleep at night knowing that their patients got the adequate protein that they needed in the low sodium diet to not swell as much. I think that's really, really neat.
Yeah.
Were there innovations in rhinoplasty? I know Asian rhinoplasty is so different than, as Asian rhinoplasty, we're oftentimes augmenting the nose, putting in silicone implants, other things like that. And the Western nose, Turkish nose, but not, a lot of these are more reductive surgeries where we're making bigger structures into smaller noses. So that must have been really fascinating. What did you learn?
There are a couple things. So one thing is that if you do rhinoplasties in Korea, your office as a doctor will have a CT scanner inside of it. No questions asked. And every patient gets a pre-op CT scan. It's included in the cost of care. It is totally cosmetic. It can't be covered by health insurance. And that helps them with pre-op planning. I can't imagine doing this in America. I can't imagine the cost. I can't imagine the lead shielding, and you can't get an X-ray tech to run the CT scan. You have to get a CT scan tech to run the CT scan. In Korea, obviously, the rules are a little less stringent. So once you get that, you're right about the reductive versus adding on. Asian noses, especially East Asian noses, tend to be a little flat at the dorsum, so they want it augmented. They want it a little bigger here. And so the most popular way is still with implants, nasal implants. So I actually took a tour of a great company. It's the largest facial implant maker in Korea. It's Bistol, Bistool. And they make actually breast implants, piriform aperture implants, malar implants, nose implants, and also chin implants and a bunch of others.
Wow.
And they offer 3D customized nasal implants. So they get your CT scan and they 3D print up your nasal implant. And whether you have a deviated septum or you want a certain amount of dorsal augmentation, whatever, they will customize it for you. They do the same thing for the chin. So I know there's a company in America that does that to a large extent. It's just relatively pricey. Most surgeons in America, we know that a custom implant is, you take your chin implant or whatever off the shelf, try to fit it in. It doesn't fit in. So then you cut it a little, then it fits
shave
in.
it.
And that's a custom, shave it. And that's a custom implant. And then I told this to the people in Korea, and they were just started cracking up. They said, that's not a custom implant. This is what we used to do 10 years ago. Like everybody is going towards a customized 3D scan printed implant, period.
Well, and we saw it when we were doing like facial reconstruction and getting, so what we'll do when we're reconstructing the jaw, whether it's trauma, cancer, someone just got it exploded with bullets or we had to cut it out, we'll go to the leg. And then with modern CT imaging, that surgery, moving the bone leg and to reconstruct the jaw, got so much easier once we got cutting guides that we knew we could shape it just so. And I imagine it's the same thing where if you have that custom implant that's going to correct the deviation and make a straight nose, not only is that going to look so perfect on the patient and they get to kind of participate in what that's going to look like, it's even going to kind of slot on just so when you put it in there, it's gonna be so precise.
Yes.
That's amazing innovation.
Yeah. And then the other thing I saw on video for the first time, and this is a technique that I've read about, but I've actually never seen. So what they do is the septum, for our viewers out there, is what divides the right left nostril. It's a piece of cartilage that looks like a triangle. So in certain cases, they will take out the entire septum. So it comes out sort of horizontal. They'll cut it, make it go 90 degrees vertical and put it back in, attach it to the nasal spine. So if you have an Asian nose or a nose with sort of mild need for dorsal augmentation, they support it at the tip. It's strong enough here and you don't need a nasal implant.
So they're pulling it up with that, like creating more support.
And obviously, to us, that's a huge deal because typically we're not removing virtually the entire septum and replacing it. That's a big no-no among at least Western rhinoplasty surgeons for the most part, because it's drilled into us like you want to have an outline, you want to have a rim of septum. You don't want to have total septal collapse. They're just like, oh, we're going to take out the whole thing and reconstruct it all.
And are they... This may be more technical than
yes.
our viewers are interested in.
Our viewers, yeah.
But I'm interested in. So, are they securing it in some way to the facial bone structure? Are they drilling holes or?
Correct.
Okay. Yeah. That makes sense. Like because I can imagine you don't want that. You wouldn't want it to slide left or right.
Right. You don't want it to slide in. You don't want it to slide out. You don't want it to just slide to the right or left. You just want it rock solid, stable, and they're able to do it. It's pretty unreal.
That's so neat. So it's funny because over here it's like such dogma that like nasal implants are so bad and they're ultimately going to extrude. And clearly we see examples of those. We have people that come, maybe they went to South Korea and had them done, and you only see the ones that are having problems, right?
Right.
But why do you think it's so much popular in Asia? obviously excluding the fact that like the diversity is, our whole population here isn't East Asian compared to over there. But why aren't they interested in using cartilage or more natural materials, do you think?
I don't know why. I've talked to the plastic surgeons there, and they do agree with me that cartilage is a much better substance. One thing they don't like is that a lot of these patients are younger, so younger cartilage doesn't really last as long. The people are smaller or physically smaller, or at least female Asian patients can be smaller, so there isn't enough cartilage even in the rib to get a nice, big, thick piece. So they would have to get extra rib. That's their rationale, or maybe that's their excuse. I don't know. And finally, fresh frozen donor rib graft is not as easy to obtain as it is in the US. So that's why.
That's why. Fascinating. What about body innovations? I feel like everyone looks so thin and fit, and they're running around Seoul and exercising with their walking. Do they even need plastic surgery of the body?
That's the thing. They don't. They're thinner by nature. Without delving too deep into it, we all know America statistically is now the most overweight country on the planet. 2/3 of Americans are overweight to obese. So Korea is not like that. I think it's because of diet and also tons of walking. So people in Korea are definitely thinner. And then it's a more conservative society, so people aren't like, it also has 4 seasons. So you're not really revealing that much of your body. Like, the winter, same in the US. In Canada, in northern US, it's not like you can reveal your body that much because frankly, it's cold in the winter. So that's sort of the reason why I think body or body contouring has not really taken off much in Korea, to be honest. And when I've talked to them, they say, oh yeah, we'll get some fat for fat grafting. Or yeah, this is a big case. And I'm looking at the case, it's like, this is like an average to thin person in the United States, and they want like 10 minutes of lipo. But yeah, they'll do it from that perspective.
So much more facially oriented surgery for the most part. That makes sense. And as everything changes around the world and we're globally exporting McDonald's in our diet, we'll see if that changes too. What about eyelid surgery? So I don't know if that's a new innovation or not, but I know it's popular to create the double eyelid sometimes.
Yes.
So what did you see?
So just for the viewers out there, Asians, about 50% of Asians have an eyelid in the upper eyelid area. 50% do not. Out of the 50% who actually have an existing eyelid fold, even then, a decent minority of patients, it's not that sharp. You can't see it that well. It's obscured, all that other stuff. So it's pretty common in Asia to view an upper eyelid fold as something beautiful and aesthetic, and so you want one created. So they have gone crazy with the precision required to create an upper eyelid fold. And so they measure stuff in millimeters, and I thought it was a joke, only because as a plastic surgeon, it's like, really, dude? You're gonna like incise something to 1/2 millimeter, 1 millimeter long. Between skin laxity and swelling and healing, it's sort of hard to predict like literally 1 or 2 millimeters. They have it down to extreme precision, so I'm very impressed. I think the take-home point for the United States is this. One thing they talk about a lot in Korea is scleral show. So to the viewers out there, it's like the white of your eye or how much is shown. So when I have actually looked at the Kardashians or a couple non-Asian Western celebrities or stars, some of them have been accused of like getting eyelid surgery or eyebrow surgery or brow lift or whatever. I think that some of them may have, and the focus has been more on the scleral show. And we don't talk about that enough in the United States. We talk about like how much skin we're removing and how much loose skin there is. And in Korea, yes, they obsess about the upper eyelid fold, but they also talk a lot about how much of the white of your eye shows. Their feeling is that actually makes you look more awake, more youthful. You don't have to remove that much skin. You may or may not have to reposition the campus or not, but That's a subtlety that I've been fascinated by this topic since thinking about it. I've read up on plastic surgery and oculoplastics textbooks, and nobody's really talking about that.
Yeah, I can't recall that being in there either. And again, for the viewers, so the canthus is where the upper and lower eyelid come together and then attach to your eye socket. So traditionally a beautiful orientation of your eyes. You want to have the lateral canthus or outer part to be more upturned. So that is considered more beautiful. So you can have neutral, and then you can be like this, and then that is associated with more like kind of like angry emotions, or you're fatigued, tired, like you were saying. And then more white eye show looks more awake. Too much can look overdone.
Yes.
So I've done this to myself with Botox before. I put some Botox too close to my lower eyelid, but I did get told I was very awake. I was like, that's because you can see, you're not supposed to be able to see underneath your iris, and you could see mine. So that's interesting though. And I think we've got some medications now in the United States, the Upneat, that are kind of exercising some of the muscles of the upper eyelid so you can see more. But I think when you look at Disney princesses and some of these other kind of more cartoon-like sketches of beauty, always huge eyes and always very, very bright, and a lot of the white portion of it, or the sclera. Yeah.
And this goes beyond ethnicity. Like, it doesn't matter what shape of your eye is or what your ethnic background is. Feminine beauty is about having like sort of a wide awake / refreshed eye, which I never really thought about before, because we're so focused on how much loose skin you have or don't have.
Yes. And, it's one of the reasons we say we like babies and how they look, because their eyeballs are adult size with tiny little heads. They got the big eyes. So that's always been postulated as one of the reasons, but we like it in adults too. Look like grown up, beautiful baby eyes.
And so this is a message for you, not necessarily for our viewers, or a warning to our viewers. Rhinoplasty, as we know, in terms of patients and in terms of plastic surgery, it's a more delicate procedure. You could do a very good job, but if it doesn't meet patient expectations, they're disappointed. And it is a very precise sort of surgery. I think that eyelids in Korea are similar to rhinoplasties in the West. The patients are always told, like, look, it's going to take 6 to 12 months to heal. You're swollen after surgery. We're talking about a precision of making incisions within 1 to 2 millimeters. And patients, from what I've heard on both sides, from the patient side and the plastic surgeon side, there's a lot of miscommunication. And so the patients are sometimes not happy, or it takes them a long time to settle down and realize, oh yeah, I'm not happy with the way I look 1 week after surgery, 2 weeks after surgery. But after 6 months or 12 months, I'm starting to look a little more natural. It just takes a long time because you have to slightly overcompensate with the surgery. Then, of course, you get very swollen. So this is where I think that they have more issues with compliance or patients, like waiting it out, because you just have that faith that the swelling is going to come down and it's going to look what you wanted it to look like. And it takes several months for the swelling to go down.
And it's such a focal point of the face. So I think it's hard to see that on yourself when you see something that it's so distorted after surgery, so swollen, and then it's all the patient can see. And we live in this era of the instant before and after. I mean, people aren't. You have a couple of times, I think, showed like a breast augmentation progression or whatnot. But everyone just goes straight to the, like the 1 year result or the 6 month result. Things can look really strange in between, just depending on the operation. And I'm always joking with my patients, because like I'll see them the next day and the next week, and for some things, like I'll see them and I go, wow, like you look great, and they'll be like, what are you talking about? Like I'm like, puffy, I'm swollen, like it doesn't look natural. And then, I have to be like, oh, you look great for one day. You look great for
Right.
1 week. Like, oh, you're ahead of schedule for like 1 day or 1 week. I'm looking at it going like, I can look into the future and see where we're heading. You can look in the future and see where it's heading. But I think everyone's so used to just the instant. That's our world. We want it right now. We want our Amazon Prime. We want everything delivered same day. Beauty results also same day. So is that, do they have, how is the med spa, like that element of it? Is South Korea into regimens that have a lot of downtime, or it's a pretty more like instant results?
They, in the derm side, the med spa side, they definitely have a more package, holistic oriented view. And more people get more services. They view it as, look, you have to get this done consistently. We're only going to expect a 10 to 20% improvement, but that's just the price you pay in terms of time and recovery and money to get there. So at the derm clinics, again, they don't really have isolated ability to buy neurotoxin or filler or laser treatment. They think it's weird if you just get Botox. They think that you need to have neurotoxin along with some treatment. They think it's weird to get just like filler. They want to give you some sort of treatment where you're treated before you get the filler to help reduce swelling, prep your skin. Then you get the filler. Then afterwards, they'll give you some mask or skincare to help reduce the swelling and potential bruising. Then they may even give you food so that it helps reduce the swelling and bruising, which I'm not totally believing, but sometimes some places do that. And then if you get neurotoxin or filler, they will do at the same time some type of laser treatment, RF microneedling treatment, whatever treatment, so that it'll improve the collagen formation, it'll improve the way it looks, it'll improve your skin quality, all this stuff. Some of it I think is a bit much or dubious. Most of it makes sense, but it just, in the US, it just takes a long time. Like, if you just get neurotoxin and filler, it doesn't take that long. But I mean, in Korea, it's like, okay, you're going to have to spend like an hour and a half getting all this stuff done, because that's how long it takes to prep, do the procedure, get the aftercare, get the instructions and all that stuff. I think the reason why they do that is, again, it's sort of their philosophy. The other thing is, honestly, price competition. They have like 20 plus neurotoxins. They have 40 plus fillers. And so we have certain brand names in the US, but they're protected by the FDA approved boats. There are very few options in the United States. So the only way to make money in Korea is to add some sort of package where you're sort of treating the entire area holistically. And a little of this, a little of that, suddenly you're talking about real money. The other issue is that they have a ton of labor in these clinics. So by that, I mean, yes, you have the dermatologist doing the injection or doing the treatment, and they typically have 2 nurses in the room. One nurse assisting the dermatologist, and the second nurse like helping the patient, holding their hand, putting ice on, stopping the bleeding, making sure hair is not in the way of the injection field. I mean, it's incredible, but I don't think that's commonly done in the United States at all.
Yeah, because cost of personnel, I think seeing 2 nurses in one room for injectables is pretty uncommon. So is this like are you going to the spa with your girlfriends? Is this like, are groups of women doing this? Are you spending the whole morning there? Is the pace of clinic a little bit more relaxed, or do they just have this very organized experience going on, like in parallel in many rooms, so they're actually working through a lot of patients?
It's pretty efficient / I wouldn't say factory, but it's sort of like a factory. Let's just be honest, because yes, it's a luxury experience. It's very nice. I mean, these clinics look spectacular to very good, very clinical, very clean. They've all the latest stuff. However, people are very efficient. So the nurses are efficient. If you have lots of questions, you can ask the nurse. The doctor steps in, does the procedure, answers all the questions, and steps out. And they have so many people as well as so many services. So it's not like the doctor's delivering the mask beforehand or the mask afterwards or talking about everything. Rather, the doctor has his role, one nurse has their role, the other nurse is their role, the receptionist is their role, the patient coordinator who helped you understand the procedure and book the procedure has their role. And so that's how it's efficient. I think that efficiency would be great in the US. And I think the best clinics, I'm sure your practice is highly efficient as well.
Always trying to be, and always trying to make it as smooth of a patient experience as possible.
Yes.
But like I say, I really I'm appreciating this Korean approach, the holistic approach, because I think it's important. And I think patients want to know that they have the aftercare that they need. And, even if it comes to like products after laser, that was something I was reading about, because I was like, I want patients to have what they need. I don't like to be like, you need to go buy this. I don't like it. I don't like to feel like I'm trying to sell someone something. But I read a statistic that said like pretty much 100% of patients after a laser within 24 hours, because of how your skin feels, they're going to buy something because they want to put something on their face. So I was like, well, if that's the case, then I should encourage them to get the product that's actually going to help them and get something that's not just like snake oil off of Amazon. So that kind of started leading me to bundle things together as well. Some of them are recommendations. Some of them actually, for like liposuction, compression garments, things like that. Like truly, it's like you need to be in it. You don't have a choice, so it will be handed to you as you go through your recovery and sizing you down and whatnot, because it's that important, and I think like so critical. But I think we could all do likely a better job with that in the United States.
I think so too. Some of it's cultural, like doctors are respected more there, like you're going to listen to your doctor. Part of it is exactly what you said. Like if you're a patient and you're paying a package deal, but you're getting everything literally possible, if it improves swelling 1%, if it lowers bruising like 5%, wouldn't you want to do it? I mean, I would. So that's what they're thinking. And I think the other thing too is that there is the cost or commodity aspect. So we talked about multiple types of neurotoxin, multiple types of filler. These laser devices are literally the same ones available in the United States, but the wholesale cost of the laser is like much lower, like half or 2/3 off. So the cost to deliver some sort of treatment after filler, or the cost of just doing some medical device, whether it's laser, RF microneedling, HIFU, ultrasound, whatever, is a lot less expensive. So to them, it's more of a commodity, and we have to combine it with other treatments to actually make more money. And patients, of course, they want to save money, but they actually also want the most complete overall treatment. So I do think it's difficult to replicate in the US because the cost of living is higher. People make more money in the US, but it costs more to live here. People in Korea make less money, but then rent or, the cost of food, things like that are much less there. The other thing is it's not just about money, it's about time. People there definitely, carve out time in their busy life to get these treatments. I don't perceive a lot of people making that commitment in the US. I think there's a smaller percentage group of people. So
it definitely takes so much effort, because they're working, they're being a parent, and they're working, they got 2 jobs, they're building companies. It's hard to get into normal clinic hours for a lot of patients.
Yes. So, but there's definitely a huge demand in Korea. I mean, it would be difficult to replicate some of these places because of the vast number of plastic surgeons, the staffing, the space. It's just unreal. But we could definitely take some lessons from them. And the technology is amazing. And the overall holistic care, that's, definitely think the way to go for us.
I think, and this was a perfect topic for us because we love talking about science-driven, technology-driven manifestations of plastic surgery and that inner web and interconnection. And what an amazing trip you took. And I am excited to see more of these international innovations in plastic surgery kind of blend into what we're doing here. And that's really what we are. We're sharing around the world. And I think there's so much more international representation across the board when we get together at our plastic surgery meetings. So an amazing topic. Thank you for gathering all that information so the rest of us could learn. And this was our latest episode of The Beauty Scientists with
Dr. Roy Kim and
Dr. Kristy Hamilton.
Well, thanks so much for joining us, and stay beautiful.
Yes, always.
Thank you for joining us on The Beauty Scientists. Be sure to visit thebeautyscientists.com and learn more about modern beauty and connect with Dr. Hamilton and Dr. Kim.